So, as you may or may not know, I've got considerable experience in healthcare security. In fact, I wrapped up my career, so to speak, as the director of security for a hospital network. That being said, nothing's really changed since I left the business because it's still very problematic when it comes to violence in healthcare and against healthcare staff. And unfortunately, here's another security officer in healthcare who was killed in the line of duty. And well, let's just take it from there. On December 25th, 2025, a patient at M Health Fairview Lakes Medical Center in Wyoming, Minnesota, violently assaulted a security officer, Andrea Merrill, age 43, after attempting to flee the emergency department while on a medical hold. The suspect, identified as 35-year-old Jonathan Winch, attacked Merrill inside the hospital before running into the parking lot, where he engaged in a prolonged physical struggle with responding police officers. Merrill was transported to Regions Hospital with severe injuries and died 2 days later as a result of the assault. Briefing point number 1. So-called routine holds are never really routine. A patient placed on a medical or psychiatric hold can escalate rapidly, even if they appeared stable just minutes earlier. In this case, the suspect attempted to flee the emergency department after being placed on a hold, triggering this fatal encounter. Operational takeaway: treat every hold as a high-risk moment. Positioning, communication, and readiness matter more than the patient's prior behavior. Briefing point number 2. Transitions and movement are the most dangerous moments. The attack occurred during an attempted elopement, one of the highest risk scenarios in healthcare security. The suspect pushed past controlled doors and fled toward the parking lot. Operational takeaway: anticipate flight attempts during triage, room changes, and door access. Maintain visual control of exits. Use team-based approaches whenever a patient is being restricted or redirected. Briefing point number 3, and this, folks, was a violent episode. Backup must be immediate, not aspirational. Police described a prolonged engagement with the suspect once they arrived, indicating the level of resistance and danger involved. Operational takeaway: security officers, especially those working alone or in small teams, must have rapid, reliable pathways to summon help. Supervisors should audit response times and staffing patterns during holidays, nights, and weekends when incidents spike. Briefing point number 4. Hospitals are soft targets without layered controls. This was the second fatal attack on a hospital worker in December, following the stabbing of a social worker in San Francisco by a patient who brought a concealed knife onto campus. So, operational takeaways: healthcare facilities must assess their assumption about low-threat environments. You must consider layered controls. This includes weapons detection, behavioral threat assessments, controlled access, and trained security presence at choke points, such as the ED or ER. Briefing point number 5. Officer safety is not a footnote. It's a system responsibility. Andrea Merrill was described as a valued team member of the security team, and her death underscores the emotional and operational toll these incidents take on staff. Operational takeaway: agencies must invest in de-escalation training, defensive tactics, appropriate for healthcare, and post-incident support. Leadership should reinforce a culture where officer safety is treated as essential to patient safety, not secondary to it. Okay, before we wrap this one up, I'd be interested in your take on it, whether you're a hospital security officer or somebody in another environment. What's your take on this? Would you go physical on this guy and try to prevent him from eloping from the hospital? Or would you let him just fly away and let the police handle it? I'd be interested in your take, whether you're hospital security or otherwise. And don't forget to subscribe, like, or do whatever. And I'll see you next time. Bye-bye.